Have you, or maybe someone you know, ever sat on that, like, incredibly crinkly paper in a doctor's office?
Oh, I know exactly what you're talking about.
Right, and you're sitting there and you describe this genuinely uncomfortable physical change, and the doctor just sort of looks at you and says, well, that's just a normal part of getting older.
Yeah, the classic brush off.
Exactly. It's a uniquely frustrating experience. You walk in there looking for an actual solution, and you walk out feeling like, well, I guess my declining quality of life is just like this unavoidable tax on aging.
Right, like you just have to pay up and deal with it.
Yes. And I mean, if you are a woman, particularly when it comes to changes around aging or childbirth or menopause, the odds are just incredibly high that these issues are going to be dismissed.
Oh, almost guaranteed, honestly.
Yeah, issues like, a loss of sexual sensation or painful intimacy or even urinary leakage, they're just routinely waved away.
It is, it's a pervasive narrative, and honestly, it's a really damaging one. There is this unspoken expectation in traditional medicine that, at a certain point, you just have to accept a decline in how your body functions. You're just supposed to wrap it up in a bow and call it, like, aging gracefully.
Right, aging gracefully.
But, I mean, there's absolutely nothing graceful about suffering in silence, or especially when biology actually has the tools to repair itself.
And pushing back against that exact, like, just deal with it narrative is exactly what we are doing today, because our deep dive today is inspired by this incredibly eye-opening article from the Menopause Association.
Yeah, written by Corina Ianculovici.
Right, yes. And she is a longevity medicine specialist and a doctorally educated nurse practitioner. But what really stands out to me about her work is that she approaches these issues not as, like, isolated, embarrassing complaints,
There you go, yeah.
but as these core components of how the human body naturally ages and functions.
Her clinical background in functional longevity is, it's really the crucial lens for this entire topic.
Right.
Because she isn't just looking at symptom management,
Right.
She's looking at actual cellular repair.
Yeah.
And that just, it completely changes the entire conversation around women's health.
So our mission for you today is to unpack a very specific and frankly fascinating regenerative treatment. It's called the O-shot.
Yeah, a real game changer.
It really is. We are going to explore the actual, like, microscopic science behind using your body's own blood to heal intimate tissues. And we're going to tackle the fear factor head on because, I mean, if you're listening to this and thinking, wait, needles down there?
Yeah, nobody likes the sound of that.
Nobody. You are not alone if that freaks you out.
Yeah.
And finally, we're going to explore why bringing women's intimate health out of the shadows isn't just like a vanity project, but it's an absolute necessity for your overall long-term health.
Absolutely.
So, okay, let's look at the physiological reality first. Like, what is actually happening to cause these issues in the first place? Well, we really have to start there because the silence around this topic, it often stems from women thinking that something is wrong with them personally.
Oh, like a personal failure or something.
Exactly, rather than understanding the actual cellular mechanics that are at play. So the article lays out how, as women age, and particularly during that transition into menopause, the body experiences these just massive hormonal shifts.
Right.
And the most significant one is this severe drop in estrogen.
And see, when people hear estrogen drop, they usually just think of like hot flashes or maybe mood swings.
Right, the standard textbook symptoms.
Yeah, but the source details how this hormonal shift causes a localized, like a drought, for lack of a better word, right there in the pelvic region.
A drought is a really good way to put it.
Yeah, because it severely restricts blood flow.
Yeah.
And it shuts down collagen production, which literally thins out the vaginal wall. It reduces natural lubrication. And then as a result of all that, it actually dulls nerve sensitivity, right? Because you're describing a fundamental change to the microscopic architecture of the tissue itself. I mean, estrogen isn't just a signaling hormone.
Right.
It's practically a structural maintainer for that entire area. Without it, the tissue essentially just atrophies.
Wow.
And that structural decline, that's what leads to the very real symptoms the author sees every single day in her clinic. Things like decreased sexual responsiveness, extreme difficulty achieving orgasm, painful friction, just due to the sheer dryness. And even mild urinary stress incontinence. Basically, the machinery is just losing its integrity.
So, okay, if the machinery is losing its structural integrity, why has the standard medical response for decades been so I don't know, superficial?
Yeah, that's the million-dollar question.
Because the author talks about masking symptoms. Like,
Yeah.
if a patient brings up dryness, they're just told, oh, go buy a topical lubricant. Or if they mention, like, mild leakage when they sneeze, they're just told to wear a protective pad. And I was trying to visualize this, and honestly, it feels like discovering your roof is leaking, and instead of calling a roofer to patch the actual hole, your doctor just hands you a bucket.
Hands you a bucket and says, good luck.
Good luck. It rains a lot at your age.
Yeah. No, the bucket analogy perfectly captures the frustration here. Because you are managing the fallout, right? You're catching the water.
Right.
But you're entirely ignoring the structural deficit that caused the leak to begin with. And that approach, I mean, that has dominated women's healthcare for generations.
But why? Like, why has the medical field historically just settled for handing women buckets rather than actually investigating how to patch the biological roof?
Well, it largely comes down to how medical research has historically been funded and really how it's been prioritized, particularly regarding women.
Okay.
Because for a very, very long time, medical innovation focused almost exclusively on acute, life-threatening conditions.
Like, if you're not dying, it's not a big deal.
Exactly. If it didn't kill you, it just wasn't considered urgent. So quality of life issues, and especially women's intimate quality of life,
Yeah.
they were just dismissed as secondary or honestly even frivolous.
Wow.
But functional longevity medicine, which is what the author practices, it completely flips that script. It operates on the philosophy that your quality of life actually is your health.
Oh, I like that.
Right. The goal shouldn't be to just get you through the day, like tolerating discomfort with a literal bucket. The goal should be to restore the tissue's fundamental ability to function as it did before the decline.
Which brings us right to the regenerative medicine aspect, and specifically the O shot. So if we are finally moving away from the buckets, how exactly are we repairing the roof?
Right.
So the treatment utilizes something called platelet-rich fibrin matrix, or PRFM, which is derived from the patient's own blood. Now, I have to be honest here.
Okay.
When I first read about treatments using your own blood, because you hear about this in like sports medicine for knee injuries or those really trendy facial
The
treatments.
vampire facials, yeah.
Yes, those. My initial reaction is to be just highly skeptical. I mean, is this just a biological gimmick that looks good on like a fancy clinic brochure?
You know, that skepticism is entirely warranted, especially given how some of these aesthetic procedures are marketed on social media.
Yeah, exactly.
But the biological science underneath PRFM is incredibly grounded. To really understand it, we have to look at the mechanics of what is actually being isolated from the blood. Because it's not just like injecting whole blood back into the body.
Okay, so what is it then?
Well, the process starts with the standard, very small blood draw, very much like when you go get your cholesterol checked.
Oh, okay, so nothing crazy.
Nothing crazy. But then the clinic uses this specialized centrifuge technology to process that sample.
So they spin it down to separate the components, right?
Exactly. They spin it really fast.
And the text emphasizes that they are isolating this PRFM because it is densely packed with growth factors and regenerative signaling molecules. And I want to make sure I'm really like visualizing this correctly for our listeners.
Sure.
Because originally I thought of it like extracting a specialized construction crew from your bloodstream and just dropping them on a repair site.
Not a bad way to think about it.
But reading further about the matrix part of PRFM, it seems a little more complex than that. Is it more like, is it like planting seeds in nutrient-dense soil? But if you don't put a protective netting over it, the rain will just wash the seeds away before they can actually sprout.
Okay, that is a phenomenal way to picture it, really. Because in your normal circulation, you have these growth factors, which are your seeds just floating around, right?
Mm-hmm.
They're waiting for a signal, like a cut or an injury, to tell them exactly where to go. So if a doctor were to just isolate those growth factors in a liquid and inject them, the body's normal blood flow would just wash them away from the area within a few hours.
Oh, wow. So they wouldn't even have time to take root.
Right, they wouldn't do anything.
Ah, so that is where the fibrin matrix comes in.
Precisely. Fibrin is essentially the biological scaffolding your body uses to form clots and heal wounds naturally. So by processing the blood into a platelet-rich fibrin matrix, you are intentionally directing those growth factors to a very specific location, and you're trapping them in that protective netting you mentioned.
That makes so much sense.
Yeah, the fibrin matrix physically holds the growth factors in the target tissue. It ensures they stay exactly where they are needed, so they can slowly release their regenerative signals over the course of several weeks.
And the physiological goals they're trying to achieve with those trapped growth factors are just wild to me.
They really are.
The author outlines this whole cascade of cellular events. Like, first, the PRFM stimulates neovascularization, which is the formation of brand new blood vessels.
Yes.
And more blood vessels mean improved circulation and oxygenation to the area. Then it triggers the production of new collagen, which physically thickens and strengthens that thinned out tissue we talked about earlier.
Well, let's pause on the new blood vessels for a second, because that is really the key to everything here.
Okay, yeah.
When you increase the vascular network in that tissue, you are essentially plumping it up from the inside. But more importantly, blood flow is intrinsically linked to nerve function.
Oh.
Right.
Right.
So when the tissue is healthier and thicker and better oxygenated, those dormant or dulled nerve endings, they begin to fire normally again.
Which highlights a really crucial distinction the author makes in the text. The goal of the O-shot is not to artificially create sensation. Like, it isn't some pharmaceutical drug that forces a temporary, unnatural chemical reaction.
No, not at all. That's a huge misconception.
Yeah.
It is purely about supporting healthier tissue function. You are literally simply giving the body an intensely concentrated dose of its own biological tool.
So it can fix itself.
Exactly. So that it can perform optimally on its own. You are just returning the tissue to its healthy baseline state.
Restoring the baseline. I mean, that sounds amazing in theory. But, you know, if you are listening to this right now, you are probably just waiting for us to address the elephant in the room.
The big one, yeah.
Because reading the phrase injections into specific areas of the clitoral and vaginal tissues triggers an immediate visceral reaction. I mean, I read that and physically winced.
Most people do.
My brain immediately said, absolutely not. I do not care how good the science is. How can anyone tolerate a procedure that sounds so inherently invasive and honestly painful?
Look, it is the single most common hurdle the author encounters in her practice. And honestly, it makes total evolutionary sense to protect that specific area of the body.
Right. It's just instinct.
Exactly. But there is this massive disconnect between the imagined fear of the procedure and the actual physical reality of the patient experience.
Okay, well, walk me through that reality because I need some convincing here.
Fair enough. First, the entire appointment, and that includes the blood draw, the centrifuge process, everything. It takes less than an hour.
Oh, that's fast.
Very fast. But the most important part of that hour is the preparation. A highly potent medical-grade topical anesthetic cream is applied to the target areas well before any injections occur.
And the article does note that patients typically describe feeling, quote, pressure rather than pain, which suggests that numbing cream is really doing some heavy lifting.
It absolutely is doing heavy lifting. By the time the PRFM is actually ready to be delivered, the area is profoundly desensitized. Furthermore, the needles used are incredibly fine. We're talking about the type used for very delicate facial procedures.
Okay, that's a bit of a relief.
Yeah, it is a highly localized, brief application of pressure. And honestly, the most shocking part for many patients is what happens after. There is virtually no downtime.
See, that part actually surprised me. I would assume you'd be, like, completely out of commission for at least a few days.
Right.
But the text says most women return to their normal daily activities immediately, like the same day.
Yeah, and that rapid recovery is the direct benefit of using regenerative medicine. Think about it, if a doctor were injecting a synthetic filler, the body might mount a massive inflammatory response to fight off this foreign invader.
Oh, sure, because it doesn't recognize it.
Exactly. But because you are injecting your own biological material, your own plasma and fibrin, the body recognizes it immediately. It essentially says, oh, this is ours. We know exactly what to do with this.
So side effects are rare just because there's no allergic reaction. The text mentions maybe some temporary mild swelling or tenderness for a day or two, but like, that's about it.
That's usually the extent of it.
However, I think it's really important we talk about the timeline for the actual results because, you know, in our modern medical culture, we are so conditioned to expect instant gratification.
Oh, absolutely.
If you take an ibuprofen for a headache, you expect that pain to be gone in, what, 30 minutes?
Right. And that expectation requires a major mental shift when you enter the world of regenerative medicine because biology just operates on its own schedule. If you are rebuilding actual tissue architecture from scratch, it requires time.
And the author notes that while the cellular regenerative process technically begins the moment the PRFM is injected, the physical tissue remodeling, that takes weeks. Like, some women might notice slight improvements in natural lubrication or sensitivity within just a few weeks. But the real magic, the progressive, very noticeable improvement that develops over 2 to 3 months.
You have to remember those seeds we talked about under the netting. They literally need time to sprout. The body has to actively weave new collagen fibers and grow new capillaries.
It's a real construction project.
It is.
Right.
And depending on the patient's age and overall metabolic health, the results of that construction project typically last 12 to 18 months before, a maintenance treatment might be desired.
That makes me wonder about candidacy then. Like, who is the actual ideal patient for this?
Good question.
Because the source is very clear that this is not for everyone. It's specifically targeted at women experiencing, difficulty achieving orgasm, severe vaginal dryness, painful intimacy, or that mild urinary stress incontinence. And it notes this is especially relevant for those dealing with menopausal changes or even unresolved postpartum issues. Interestingly, though, it seems like the ideal candidate is often the woman who has already tried the buckets we talked about.
Oh, almost always.
Like she's tried the over-the-counter lubricants. She's done 1,000 Kegels.
The endless Kegels.
Yeah, the endless Kegels. She might even be on standard hormone therapy, and she still just isn't getting the functional relief she needs.
That's a very common profile for this.
Yeah.
But equally critical is understanding who should not get this procedure.
Okay, yeah.
The author stresses that a detailed, comprehensive medical consultation is completely non-negotiable. Women with active pelvic infections, specific blood disorders, severe platelet dysfunction, or those on certain medications that actively inhibit platelets, they are simply not candidates.
Well, that makes sense, because if your blood's inherent ability to heal is compromised systemically, extracting it and spinning it in a centrifuge isn't going to just magically fix it.
Exactly. If the seeds are dead, the netting doesn't matter.
Right.
And this points to a much larger philosophy that the author emphasizes throughout the article. The O-shot is not a standalone magic bullet.
I noticed that too. The author seems very adamant about not overpromising this as like a miracle cure on its own.
And that is the hallmark of a really responsible functional medicine practitioner. They recognize the body as a complex, interconnected system. The O-shot provides an incredibly powerful, localized regenerative spark. But if you want a fire, you still need fuel and oxygen. Its true potential is only unlocked when it's part of a synergistic approach.
Right. The article details combining the treatment with hormone optimization, targeted pelvic floor physical therapy, nutritional interventions, and even lifestyle strategies. You are hitting the problem from every conceivable angle.
Think about it functionally. You use the O-shot to grow new healthy tissue.
Yeah.
But you might need systemic hormone therapy to actually maintain that tissue long term.
Oh, I see.
You might need pelvic floor therapy to strengthen the muscles supporting that brand new tissue. It is a comprehensive blueprint for actual longevity rather than just, a quick fix.
And that phrase, functional longevity, it really brings us to the broader societal implications of this treatment, which is arguably the most important part of the entire article.
I agree.
Because if you read a headline about a regenerative treatment for intimacy, it is very easy for a skeptic to dismiss it as like a vanity procedure.
It happens all the time.
Right. Something for the wealthy elite, a luxury that is entirely separate from real medical care like cardiology or oncology. So how does the author's focus on functional longevity really dismantle that viewpoint?
She dismantles it by forcing us to look at the cascading effects of ignoring intimate health. Because the text states incredibly clearly, sexual health is intimately connected to emotional well-being, self-confidence, relationships, and just overall quality of life.
Yeah.
If we only define health as the absence of a fatal disease, we are setting the bar horribly, horribly low.
There's a line in the article that really stuck with me. It says, when intimate health declines, the impact often extends far beyond the bedroom. We are talking about women who have suffered silently, sometimes for decades, just because society has conditioned them to be too embarrassed to bring it up to their doctor.
Yeah.
Or worse, they did bring it up and their doctor told them it was normal, so they just internalized the idea that they have to live with a broken body.
And that cultural silence is physically and psychologically toxic. It just isolates people. But what is so profound about Corina Ianculovici's perspective is that she tracks the actual domino effect.
Okay, tell me more about that.
Let's take mild urinary stress incontinence, which is one of the key issues the O-shot addresses. If a woman leaks a little bit every single time she sneezes or jumps, what happens?
Well, she probably stops jumping. Like, she stops going to her aerobics class. She stops lifting weights at the gym because she's terrified of having an accident in public.
Exactly. She alters her entire active lifestyle just to manage the symptom. And when she stops exercising, her cardiovascular health begins to decline.
Oh,
Her
wow.
bone density drops because she isn't doing resistance training anymore. Her metabolic health suffers. So what started as a localized, intimate issue has now directly compromised her systemic long-term longevity.
That is wild.
You cannot separate a woman's physical pelvic discomfort from her ability to move confidently through her daily life. It is all connected.
You know, when you lay it out like that, calling this a vanity procedure is just wildly ignorant.
Truly.
It's about preserving the fundamental physical functions that allow a person to actually stay active and engaged in their own life. I mean, it's preventative medicine in a very real way. And the author concludes the piece with this really powerful, definitive statement. Intimate health is health. Treat it that way.
It serves as a rallying cry for the entire medical community. It represents a long overdue paradigm shift. For generations, the medical system has treated the aging female body as a burden to be managed with quiet resignation.
Yeah. Just hand them a bucket.
Exactly. But this treatment, and the really deep regenerative science driving it, it proves that we now have evidence-informed solutions that actually respect the body's ability to heal. We're finally having the clinical conversations that should have been standard practice decades ago.
It really is a massive, exciting leap forward. Okay, let's take a breath and do a quick recap of the journey we've just been on together.
Sounds good.
We started with the incredibly frustrating reality of the status quo, which is the historical medical habit of simply masking the symptoms of hormonal decline with topical fixes and absorbent pads.
The infamous buckets under the leaky roof.
Exactly. Then we looked under the hood at the fascinating cellular science of PRFM and the O-shot. We learned how a simple, everyday blood draw can be centrifuged to isolate a specialized biological matrix acting like a protective netting over regenerative seeds. This matrix is then used to stimulate the growth of new blood vessels, new collagen, and entirely new tissue architecture.
And we made sure to clarify that this isn't about artificial enhancement, right? It's rather about giving the tissue the exact tools it needs to restore its own natural function and baseline sensitivity.
Yes. So important. And then we tackled the ick factor of the procedure itself, confirming that thanks to heavy-duty topical anesthetics and incredibly fine needles, patients experience pressure, not pain, with zero downtime.
Which is huge.
Huge. We established that biology demands patience, though while the process starts immediately, the physical rebuilding takes a couple of months. And most importantly, we broke down that toxic silence around women's bodies, proving that intimate health is an undeniable cascading factor in our overall functional longevity.
It's a topic that really challenges everything women have been taught to just blindly accept about getting older.
It absolutely does. Which leads me to a final thought I want to leave you with today. If science is now advancing to the point where we can harness the power of our own blood to literally reverse the inevitable decline of our most intimate, sensitive tissues, what other physical declines have we quietly accepted as just a normal part of getting older that regenerative medicine might soon teach our bodies how to fix?
Oh, that is a phenomenal question.
Right. It really makes you wonder how many other buckets you might be holding in your own life when you could actually be repairing the roof.
It completely changes how we view the future of aging.
So the next time you are sitting on that crinkly paper and someone tries to tell you that your discomfort is just an unavoidable part of getting older, remember this deep dive. The science is evolving so much faster than those old excuses. You don't have to just live with it.